I am Kathy Kittle. I live in Valley, Alabama. About 4 years ago, I started having breathing problems, and I would land in the hospital for 3 or 4 days, but I didn't have a diagnosis. They thought it was something in the atmosphere, but then it kept happening. 3 months later, I'd be in the hospital. 3 months after that, I'd be in the hospital. So it took both the pulmonologist and my regular doctor time to figure out it's chronic. You do react to it, but it's not asthma. It's not like you're allergic to something. It's COPD, which is how I ended up with a breathing machine.
When I first met Miss Kittle, we started out with trying to get the home ventilator. The insurance that she had at that time denied and stated that we needed to get her a BiPAP instead. We knew that the BiPAP was not going to be beneficial at that time, so we worked to get the home ventilator, which in the end we did.
The first machine I got was a BiPAP machine, and it was making me breathe. It was forcing air in way more often than I would have breathed normally. It was work. It was a lot of work. Even if it was expanding my lungs, it was still a lot of work. So the ventilation therapy was different. It adjusts to the way I'm breathing. So it helps me breathe when I want to breathe, rather than making me breathe.
She went from staying at home and struggling and having to think about every single breath to now she is able to go out and enjoy things, and it has greatly improved her quality of life and the things that she has been able to do, and the ease of breathing now is much, much better.
Before the machine, I could barely walk to the bathroom. I have dogs. I couldn't walk my dogs. I couldn't sit here right now and speak to you without oxygen. I couldn't do it. Absolutely couldn't do it. And I was in pain. Every muscle from your neck, all your upper chest muscles. I mean, it was a nightmare. I kept telling my respiratory therapist, I want to do this, but I'm afraid I can't do this. And she's like, we're going to get you to do that. We're going to make it so you can do that. This machine is going to help you, and you're going to be able to do that. And she was right. She's absolutely right, because now I can do it.
The earlier that a patient can be prescribed this, the longevity of their life will be greatly impacted, and they will be able to have that quality of life and be able to go and do things and be around with their family. But we are willing to help anyone at any stage to get the home vents.
I'd recommend VieMed every day. I would recommend them for their ease of service, how quick they respond. The personal level of service is something I've never had. When you can't breathe, you're scared, and it helps you not be so scared. You can face it with knowledge and know that you have support and the equipment that you need to get through it.